Hi guys, Sandra Ryerson here, Doctor of Audiology and owner of Adaptive Audiology Solutions. My goal for 2021 was to provide you guys with smaller videos, shorter content, just to help you learn things without making it too overreaching and too complicated. So, in honor of Tinnitus Week this week, I thought I'd talk about tinnitus. Tinnitus can be pronounced tinnitus or tinnitus. It is the sound inside the head or ears that is not created by an external source. And what should you do if you have tinnitus? The first thing you should do is get a hearing test. By getting a hearing test, the professional testing your hearing, an audiologist, will be able to determine if you should see an ear, nose, and throat physician. Conversely, if you go to an ear, nose, and throat physician first, that's fine. It's just that they're going to order a hearing test and then bring you back in again. So it kind of it just cuts a little bit of the work out for you by getting a hearing test first. And after the hearing test, if there are medical concerns based on this test results and your tinnitus and what you're reporting, then an ear, nose, and throat physician should evaluate you to rule out anything medically concerning. And may order an MRI or a CAT scan. That's unusual, but it can happen. Okay, so for the rest of people, the majority of people with tinnitus don't need any kind of ENT referral. They just need to understand why they're experiencing this noise in their head. So 90% of people with tinnitus habituate naturally. They get used to tinnitus on their own over time, but it can definitely be encouraged to improve, and that habituation can be increased and sped up by counseling and by the audiologist telling you what's going on with your tinnitus and what can be done about it. Oftentimes, tinnitus is a symptom of hearing loss, so many times treating the hearing loss really enhances the patient's ability to habituate to their tinnitus. About 60% of people find an incredible amount of relief from their tinnitus by wearing hearing aids. So that is a great thing to know. Also, counseling is huge. Knowing why that noise is in your head can really help people, along with when you go to someone that really offers tinnitus treatment, they should have a variety of suggestions of how to live with the tinnitus and help you with your habituation. And that's the other thing, is that for those 10% of people, if 90% can habituate, 10% of people don't habituate well. What do they do? Then they need a tinnitus treatment plan. And a tinnitus treatment plan is not just wearing hearing aids or even wearing a hearing aid with a masker in it for tinnitus, and I won't get into what that is. But a tinnitus treatment plan is a full encompassing plan with a lot more education, perhaps some cognitive behavioral therapy strategies built in that the audiologist can provide or will refer you to the correct professional to provide. I have a wealth of resources for my patients that come in with tinnitus, and we send them home with papers in a folder for them to research, and I can offer hours of care depending on what their needs are, along with, if needed, a tinnitus masker device or other devices. So certainly do not think that just a hearing aid is all that is out there for you. Okay, so that's really important to know. And lastly, the most important thing to know maybe right now for most of you is to prevent tinnitus, you want to protect your hearing. Tinnitus is most often caused by noise exposure, so protect your hearing. Wear ear hearing protection when sound is loud enough to be damaging. Okay? And secondly is to take care of your health. If you take care of your overall health, if you abstain from nicotine, okay, and get a good night's rest and manage your stress well and watch your caffeine intake, all of those things will improve your quality of life, your health, and the chance of you developing tinnitus. So be careful out there to stay safe, and I'll see you next time.